see it just about everywhere, but doctors at OSF say we're only about 4 weeks into the real center of flu season, and according to the CDC, it is shaping up to be one of the worst in decades. Good Monday evening, everyone. I'm Tyler Lopez.
And I'm Caitlin Canute. Thank you for joining us this Monday evening. Caitlin Pearson talked to local medical professionals about what they're seeing. It is tonight's top story. She joins us live in studio with the latest. Caitlin.
Now, we all know during this time of year to cover your cough, keep hydrated, and wash your hands. But if you find yourself with some severe symptoms, that pack of emergency may not be enough. Medical professionals at OSF say their ER is full of people sick with the flu.
The emergency room at OSF St. Francis Medical Center is on high alert with a fast-moving flu season. Nursing Director of Emergency Services Debbie Trow says their number of patients keeps going up.
So the flu trends, according to the CDC and public health departments, are tracking probably some of the worst flu we've seen in up to 40 years. Flu we're seeing is respiratory. It's not gastrointestinal like a lot of people call the flu. It is a respiratory ailment and it impacts your immune system as well.
Medical Director for the Emergency Department, Victor Chan, says flu symptoms come on very quickly.
Fever, body aches, and cough, and those are the telltale signs of influenza. If you're having the nausea, vomiting, and diarrhea, those are maybe more of what we call like a GI flu or stomach bug flu.
The most at risk, babies, children under 2, the elderly, and those with pre-existing conditions.
There's a medication that's an antiviral medication that you can start within 2 days, and after 2 days, it's not much help.
Your best defense is the flu shot, which takes 2 weeks to process in your body.
You may feel the body aches. It's your body's response, your immune system ramping up to prepare to fight off the flu so that you can build these antibodies to fight off the flu.
OSF's priority is to keep their patients safe. So if you think you may be sick, it's best not to visit others in the hospital.
Some of our patients who are already sick, being exposed to a virus, can really make them that much more ill and be life-threatening to them.
In Illinois, the Department of Health reports nearly 200 ICU admissions due to the flu since September, and 56 of those were in the past few weeks alone. Caitlin.